Hi, I'm talking to Dr. Richard Shaffer, an oncologist who treats Dupuytren's and Ledderhose with radiotherapy. Richard, can you tell me, what does radiotherapy do to the nodules in our hands and feet? What happens to them?
Yeah, thanks, Anna. So, the response to radiotherapy is a very slow response. So, if you have your week of treatment, 3-month gap and a week of treatment, some people do get some response by the second week of treatment, in other words, after 3 months. But I have to say, most people don't really get much of a response till, on average, about 3 months after the second lot of treatment. So the time between starting your initial treatment and getting, a response, on average, I would say is roughly 6 months. So, you're very lucky if you get a good response before then. But, if it's slow, don't worry. You can still get a response. And the other thing I will say is I've had people having a response up to, let's say, a year after the end of treatment. So this is a very, very slow thing. It's not like taking a paracetamol and your headache, that sort of thing. The response is very variable. Generally, particularly in Dupuytren's disease on the hands, we're really looking to stabilize things. So from my point of view, if patients say, there was no change, I would say that's fantastic. That's exactly what we were hoping for. If we can delay this getting worse, then that's a good thing. On the feet, of course, if it's growing and we can stop it growing, then that is success. But for most people, they come to me where they have pain or discomfort already, and they really want to know, what's the chance of it getting better? The chance of it getting better is around 70, 80%. And again, that can be a pretty slow response, and it often goes along with the nodules getting smaller. Most of the time, they don't melt away. In other words, you're still going to be left with something. But you certainly can get a response in terms of the tenderness, the pain, and the size of the nodule getting smaller. On the hands, it's pretty similar. So I've said, if we stabilize it, that's success. But for some people, they can get smaller. And I just think in general terms, the softer they are when we start, the more likely they are to get smaller and softer. Okay? And that may well be because the softer they are, often the newer they are, the less time they've been there for. By the time they go very hard, often that means they're a little bit more scarred, they've been there for longer. And what happens to those ones? Sometimes, again, they don't change. But sometimes what happens is, although we might be successful in stopping them growing, they may well get harder. Now, that in itself doesn't matter in terms of affecting the hand function, it's just something to be aware of. The last thing I'll say is that sometimes people find the nodules can actually get bigger or more tender in the short term before they get better. Now, I call that a flare in the nodules, so, they can just get a bit more inflamed. That tends to happen after a number of weeks or months and can last for a number of weeks or months. So if that happens to you, don't worry. All is not lost, and it may well get better. Of course, there is a chance that it may be that your nodule just hasn't responded to radiotherapy. But I have to say, most people find that, if it gets a bit more tender, gets a little bit bigger, you just take some paracetamol or something to get yourself through that. Wear soft shoes, just be a bit more careful, and then you come out the other side and you may well have a good response at the end. That certainly happens to most people.
Thank you.